So with me today is Tamira Loewen, a senior manager, risk management. And Tamira, you've had some experience with returning to work after some mental health challenges. Could you set the stage for us a little bit? Tell us a little bit about that experience.
Sure. So there was 1 year in particular, well, the only time I've ever actually been off work, but it ended up being twice in 1 year. The first time, I was very desperate to get back to work. I was, worried about the perception and what this might mean for my job and my career. And so I essentially was desperate to get back to work and reestablish myself, and went back as quickly as I could. And 4 or so months later, ended up crashing and felt the need to take a little bit more time off.
To me, it's so familiar. I mean, most of the folks I've talked to really want to work, and sometimes are so eager that that we're not quite ready, and away we go. Is that kind of what happened to you? Tell us a little bit about that dynamics of those 4 months at work, and kind of why it maybe didn't work out as well as it could have.
I think there was a lot of factors. Obviously, my own physical or mental or health, whatever you want to label it as, was the biggest challenge. On top of, and just the sort of desperation after having to be off once, of proving myself and being able to show. I think it put a lot of additional stress just beyond what I was having to deal with to begin with. Now, most of that, I would say, was self-inflicted at the time. My own views and perceptions of what other people might feel about me. But I think when you're, for me, some of the mental health challenges are this overwhelming sense that the world isn't a safe place, and you can often get responses that just unfortunately seem to justify that fear, especially when you're having some experiences that maybe other people don't understand, or you yourself even don't understand.
So let's just talk about that a little bit. I know myself, I sometimes am not sure what to say or not say when we're exploring these kind of issues. What kind of reactions or interactions did you have with your coworkers and supervisor?
So my coworkers and supervisors, they were all really great. I think they were sort of not probing. I think there's, when somebody is off work, there's all sorts of rules about what you are allowed to ask and not ask, and they were all very respectful. But I think I also had a good relationship, and a lot of these people remain in my contacts and my friends today. So the dynamic of the people that I worked closely with, and colleagues and supervisors, that was all actually very positive.
And what about the disability insurer? What was that relationship like, and how did that impact your return to work and ability to maintain work?
So I think the first time I went back to work, I thought it was great, because I was more worried that they would prevent me from going back, or they would say I wasn't ready. And they were just as eager for me to get back to work as quickly as humanly possible as I was. So the first time I thought it was all great. The second time, I actually I went on leave, and it didn't get approved. And my experience the second time around was really not positive. I had difficulties even connecting with anyone on the disability side to understand what the process was or where things were at. My claim got rejected twice without a whole lot of rationale for why it was, or what was going on. So on top of the additional stress of just trying to deal with life as it was, I had this additional I had no income coming in. I didn't know what that meant for the status if it didn't get approved for my job itself. And so it was a whole lot of additional stress in a time where I was stressed. And if they'd been more transparent and easier to connect with or actually get a hold of, often calls went unreturned. That would have been helpful. Eventually, I realized like I wasn't there. You know, I did get a little bit better, and then I eventually just wanted to go back to work. I didn't know what the status of this was, and I didn't feel like I was making a huge amount of progress, and maybe just getting back to work would actually be what I needed. And then so I did go back to work, and then I think once your claim is denied 3 times, that's it, and you'd have to take legal action if you wanted to pursue it further. So the 3rd time it was approved, and the day after it was approved, so I was back at work at that time. The day after it was approved, I did get a call from the disability insurers, basically telling me I had to be back full time. So I'd gone back 4 out of 5 days a week to start with, and that was just sort of arranged with me and my colleagues. I don't really understand what happens in the background when something's not approved. And so the day after it was approved, I did get a call from disability letting me know I had to be back to full-time work no later than, I don't know what time was, but maybe it was a month or 3 weeks from the date they called me, and letting me know that I didn't qualify for long-term disability. It was a pre-existing condition, and you know, basically just not a very helpful or positive experience.
And so here you are, you know, already feeling the pressure, and it feels like that, you know, the disability carrier then is just adding more onto your plate.
Yeah, and yes, sorry, go ahead.
No, I was just, you know, wondering how could it be done differently or better from you know, from your perspective?
Well, when I was off and it wasn't, there could have been a lot more contact. So it was a struggle to actually get someone to actually connect with me. You know, I would call, and I think maybe they would return my call a week or 2 later. Weren't providing a whole lot of information on why something was disapproved, why something wasn't being approved. It wasn't at all supportive. It added to the stress. I can't say for sure what if this or that or how, you know, but I think had that stress of not knowing what was happening or why things were being and I don't think they really had a leg to stand on as far as disapproving, because they had sufficient evidence of a condition from my previous time off, but it's more of filing paperwork. So it seemed like more of an exercise in just doing whatever was possible not to pay out in disability insurance. Whereas, you know, had I had support from the start, had it just been approved, because I think they had all the basis they needed. They just, it was a paperwork thing. Or
so, Tamira, you now are in a new position, and you're active within your organization around inclusion and disability. So when we think about going forward, how can then we create conditions in the workplace that really achieve that principle of inclusion?
So, I mean, having disability or having diversity and inclusion initiatives that are really bought into, and you can really tell the difference, I think, when something is just a marketing gimmick or everybody else is doing it, we have to do, or people really really do care and are interested in what they're doing. And I think anything that really promotes a culture of diversity and inclusion benefits, everyone, because everyone is different in some way, whether it's race or sex or religion or sexual preference or disability. Everybody is different, and I think we have these underlying biases that there's somewhat of a fear of difference. It's a biological response in order to protect us. But when you do things that promote the spirit of inclusion and diversity, you sort of become a little more accepting of everyone's differences. And when you see people being treated, so I've heard instances of people who have had to go off and their bosses or supervisors calling HR and making sure that, we're putting the person first and making sure that they're being treated well. And with respect and it's sort of a humans first approach. I don't think it's rocket science. Treating people with respect, a little bit of empathy, and as human beings is sort of key, but unfortunately common sense isn't always all that common.
Well, Tamira, thanks so much. I think that's really an important message, that to treat everybody with respect and acknowledge that we are different. And thank you so much for sharing some of your experiences.
You're welcome.
Thanks again, Tamira, for sharing those reflections. My name's Steve Mantis, and I'm the moderator for our session today. I'm really excited about this session because I've seen both Louise and Ellen give similar presentations earlier this year, and I was thrilled. And I went, oh my gosh, we can maybe get to have them share with you all today as well. So I'd like to introduce Louise St Arnaud. She is a professor at Laval University. She's a psychologist, a career counselor, and a full professor. Her research work is characterized by the design and implementation of research projects in close collaboration with the practice environment. This is really key from my experience as an advocate for people with disabilities, is that the engaging with the workplace parties is a real key to getting it right when we're talking about what really works in the workplace. I would also like to introduce Ellen MacEachen. Ellen is a professor at the University of Waterloo. I've worked with Ellen for almost 20 years, and I just think she's the best because she really listens to the people that she's working with. She has a great respect for people with disabilities and injured workers, and she really integrates that into her practice. Her research examines return to work, vulnerable workers, and the growth of precarious employment. Her current studies examine how gig and low-wage employed workers are navigating in the context of the COVID-19. And in her 2019 edited book, The Science and Politics of Work Disability Prevention, it provides an international picture of social security systems, work, and health. All right, I'd like to turn it over to Louise to start her presentation. Welcome.
I'm very pleased to present this guide to support the return to work to employees who have been absent due to mental health problems. The guide I'm presenting to you today was produced as a result of several studies conducted with workers who had been absent due to mental health problem. And our previous research showed us that most of the workers who had been absent due to mental health problem are absent due to work-related problems. We also observed that the return to work does not mark the resolution of health problems. It was not because workers returned to work that their problems were solved. Many of the workers who had been absent to work and when they returned to work were not doing well. So we're able to document that when the return to work process did not address work-related problems, the return to work was less sustainable and workers were more at risk of relapse. This reality is the same regardless of the reason for absence, whether work-related or not. The answer always depends of the ability to consider work in the return to work process. Even if work is not always the main cause of the mental health problems, or research has shown that the solution requires taking work in account. You can download the detail of my first research in English on the website of the RSST website. In light of this first research, it had become very important to design and support programs that will allow us to intervene directly on work-related problems. The guide is a practical tool to combine individual support and organizational change. It was also developed with the support of Institut Robert Sauvé Occupational Health Research Center in Quebec. And it is intended for managers, human resource services, and labor groups concerned about worker health and job retention, but also for workplace practitioners, including physician and occupational health worker, organizational psychologists, and also rehabilitation counselor. The main objective and the originality of this guide is to design and support programs that will allow us to intervene directly on work-related problems, recognize the role of work on health and the risk associated with work-related problems, and moving from an individual rehabilitation approach to an organizational prevention focus. We go beyond the identification of accommodation measures to create a healthy work environment that will ensure the integration of all employees into the workplace and job retention for all. And the ultimate objective of this guide is to move from an individual rehabilitation approach to an organizational prevention focus. This guide is divided on 4 parts, and the first part presents the different aspects that must be considered before implementing the support process. These different aspects include the recognition of central role of work on mental health, and the process goes beyond the psychopathology and medical treatment and moving toward an integrated occupational health process that reflects the complexity of human being at work and the need to put work on the heart of the process. What does it mean to recognize the impact of work on health and the risk associated with work-related problems? It means being willing to intervene in the work organization. It means adopting practices based on the analysis of work situations. It's a perspective that fully engages worker and workplace stakeholders. This is the core of the program proposed in this guide. The focus is on the ability to identify and address work-related difficulties, an approach that engages all stakeholders in the workplace, including unions, the immediate supervisor, and also senior management. However, one of the challenges of the effectiveness of the approach will depend on the ability to uncover the hidden face of contradictory practices, because workplaces are full of contradictions. On the one hand, there are the issues of economic rationality with the high cost of absence and the logic of insurance. And the other, there is the human and social rationality on health and well-being. These two rationalities are in constant conflict and result in a series of contradictory practices on the workplace. For example, We can see how senior management says that want to implement a supportive approach, but at the same time maintain in place coercive measures to control absence, such as contesting disability claims or pressing for a prompt return to work without addressing work-related issues. Or supervisors were asked to listen to their workers to help them by improving the work organization, but at the same time, they are under pressure to lower absence rates, increase productivity, and often to do more with less staff. These contradictory issues undermine the credibility of the approach to disability management and the confidence of the stakeholders in being able to improve the situation. The groundwork must be done to ensure that the measure and practices adopted will be coherent. I can tell you that this aspect on the process is very important to the success of such program. It is perhaps also one of the most challenging. So the second part of this guide present the various measures to be taken to be implemented to recovery return to work process. During this step, good intentions are translated into action. Senior management must make a clear commitment to support its vision and what this means in terms of change. This vision based on the analysis of work and the challenge it raises, must be shared by all staff, management, senior staff, the union, and workers. The role and responsibilities of each of the workplace stakeholders must be clear, and practices must be coordinated by a neutral facilitator. The third part presents the detail, the 7 operational steps for supporting and monitoring absent worker and their supervisor. These steps are managed by a coordinator who will assist employees from the time they stop working until the follow-up stage after they return to work. The 7th step included begin the process as soon as the first administrative procedure are initiated, make the first contact with the worker, assist the worker in his recovery, prepare for a meeting with the immediate supervisor, develop a draft and return to work plan, facilitate the return to work by implementing the plan, and do follow up on the return to work and make any necessary adjustment. One of the most important is to prepare for the return to work well before returning to work. This preparation helps to reduce the risk of negative anticipation of having to return to work under the same conditions that preceded the absence from work. A space is created to discuss work-related issues and action to improve the situation and facilitate the return to work. This preparation included a meeting with immediate supervisor to discuss work situation and plan the condition for return to work. We create a space to think about work, a space to give the worker the possibility to examine his work, what he does, what difficulty he has, what makes sense for him in this work, and what can be improved. To enable the worker not only to regain his or her ability to work and rebuild a positive connection with the workplace, but also to engage in a real discussion about work situations. This provides an object for discussion and action around work rather than around the disease. This discussion space helps to transform mental health risk factor into protective factors. The lack of recognition at work, poor support from supervisor and coworker, and lack of decision-making control to decide how to get the job done are the most significant risk factor for mental health in work. The link between the presence of this risk factor and mental health problems in the workplace has been clearly demonstrated and validated by the scientific community around the world. Conversely, feeling supported in difficult situations, having an influence of on their work, and feeling respected and valued are all factors in the prevention for mental health problems in the workplace. Being listening to being able to discuss the work and having support in the work are preventive factors in mental health in the workplace. In this sense and in this way, that the approach makes it possible to transform mental health risk factor in preventive and protective factors in mental health in mental health in the workplace. The major challenge for immediate supervisor is to recognize the impact of work and management practices on the health of workers, shift from the paradigm of controlling absence to one of supporting worker by focusing in improving work organization, being listening to be management and having the latitude to improve work organization. The immediate supervisor ability to listen the employee's work problems depends on the supervisor ability to be listened to by his manager. This last point is the most important. We cannot think opening a space for discussion between the worker and his or her superior without there also being a space for discussion between the superior and senior management. This is why it is necessary to plan the process from the outset. The process must be part of the organization's real commitment to take action on mental health in the workplace. And when I was talking earlier about having a coherent space, a coherent set of practice, this is one of the things I am thinking about. And the last part of in the guide described the return to work support process as well as action that can be taken to prevent mental health problems. We want to shift from the rehabilitation to prevention. We are shifting from an employee assistance program to an organizational assistance program, an OAP. The question is what concern one worker may also affect several workers. Based on the identification of work-related problems affecting the absent worker, we try to find out how these factors can also affect others' worker. The idea is to identify some topics that will be used to initiate a discussion on preventive action in mental health, moving from a case-by-case intervention to one that target all exposed workers. We move from rehabilitation to prevention in occupational health. Closing the loop on the prevention is an essential or worker retention. The ultimate goal of this approach is to ensure the shift from rehabilitation to prevention in mental health in the workplace. This is the condition that will ensure not only the return to work of workers who have been absent due to mental health, but also their retention in the workplace. This condition also make it possible to create a work environment conducive to the retention of workers in employment. Well, this is my presentation. This is what I want to talk to you today. And thank you for your attention and for your presence in this website.
Thank you so much, Louise. I'm inspired by your talk. I just feel like you have so much to share that's really important, that connects the dots together. Ellen, can I turn it over to you?
Thanks so much for inviting me to speak today. I'm really pleased to be here. So I'll be talking about a guide that we put together focused on return to work and mental health that was based on return to work coordinators' accounts of their challenges and practical strategies. So this is a guide that I put together with my co-authors from the University of Waterloo. Before I go further, I just want to acknowledge that we got the funds for the WSIB grants program to do this research. And the research was guided from the beginning through to the end by our stakeholder advisory committee. You can see Steve Mantis is sat on the committee. We also had representation from the Workplace Safety and Insurance Board, from disability consulting organizations, OPSU, from human resource professional associations. And so they were there throughout to help us to think about the purpose and the focus of this study, and especially near the end when we were putting together the guide and considering its core focus. So an overview of the presentation. So I'll be presenting the Return to Work and Mental Health Guide. You can see a picture of the cover here. I'll also be talking about the business reality of return to work, which is a less discussed backdrop to return to work. It was another aspect of our findings that that I have whole presentations on. But Steve was asking about this issue recently, and so I decided to tack it into this presentation as well. So we'll talk a little bit about this at the end, about the business aspect of return to work. And also our study was involved interviewing return to work coordinators, and we developed a focus on the mental health of the return to work coordinators themselves as we went through this research, and I'll talk about that. So the challenge of mental health and return to work systems. Basically, our return to work systems were developed with the idea of physical injury in mind. If you look at functional abilities forms, they ask questions like, how much weight can this person lift? A lot of the system seems to be set up with the idea that someone will be ill and then get better and return to work, and don't take account of chronic ongoing conditions that are often more so the case with mental health. So there's a challenge fitting mental health into return to work systems. There is an emerging literature on this, on return to work and mental health and return to work coordination around this. A lot of it focuses on sort of the best practices approach, like what are the ideal ways to go about doing this? And we have an example, just some of the literature here that's coming out on it. The focus of our guide was on a practice focus rather than, and what I mean by that is that what we did is we went to people who were coordinating return to work coordinators who are growing profession, and we asked them what they encountered in their work, like what problems are you encountering and how do you manage it? So the guide is based on their sort of practice focus, their day-to-day realities. And we were interested in return to work coordinators because they're basically at the middle of the system, right? They're interacting with workers, insurers, the different workplace parties like co-workers and managers, as well as union representatives, healthcare providers. So that led us to our research question, which was basically, what are the actual challenges related to return to work for people with common mental health problems, and how do return to work coordinators manage them? So for this study, one of our key goals was to create a strategies guide that could be used by stakeholders. When we say we talk to return to work coordinators, not everyone has that as their formal job title. And so the way we identified who they were for the purpose of our studies is we said, do you manage return to work as a part of your professional role? So we ended up having these, what we called return to work coordinators from across Canada. They worked, a lot of them worked in-house in large organizations, and that was their job, is to manage work absence and return to work. There were also third-party consultants that provided their services to smaller businesses often and large businesses on absence management and return to work. We talked to people in workers' compensation, in big private insurance firms, and also with unions who are part of return to work committees. And with all of them, we were focusing on common mental health disorders. So things like depression, anxiety, and addictions, and they all needed to have experience with that sort of situation. So we conducted a total of 47 in-depth interviews with these coordinators in 2018. And we analyzed our results in a way that sorted them into 3 key contexts for return to work. So one was the work context. So what are some return to work strategies that involve the key workplace parties, the co-workers, the supervisors? A second context was the health context. So what are the issues around health and healthcare that we need to focus on? And then the third context is the claims context, and that was the return to work coordinators themselves. Like, what are some effective communication strategies that they used in their work? So, so our guide, we end up calling Roadblocks and Alternate Routes, Practical Strategies for Managing Mental Health and Return to Work. We developed the guide based on these interviews that I just described. And then we developed a draft of the guide and took it out to return to work coordinators in a workshop and said, does this work? Does it make sense? We got feedback from them. We refined it, developed the guide again, and validated it with the workshop. We also worked very closely with our stakeholder advisory committee with the guide, making sure that it had the right tone, the right focus, the right content. The idea is that this guide is something that can be used by a variety of different users, workers themselves, worker representatives, employers, insurers, and unions. We have some guiding concepts for this guide. What key is that there's unique challenges and opportunities with return to work and mental health. The concept of objective medical evidence is difficult to apply, often with physical health and especially with mental health. There are aspects of people's minds and lives that are difficult to measure. Excuse me. And a DSM diagnosis is made through clinician interpretation of self-report instruments, right? So you're not going to get an X-ray to help diagnose your mental health. So there's a lot of interpretation, and that plays into the whole claims process. Within return to work, it's very common to have a focus on functional abilities. Let's move away from diagnosis and just focus on functional abilities. And we just draw attention in the guides that with mental health and return to work, that's not always possible. For instance, it's possible to be quite seriously ill with mental health condition while not presenting as sick. So for instance, someone might be involved in intense social and physical activity and be quite ill. As well, people with the same diagnosis may display symptoms differently. So that brings us to the key strategies that you'll see throughout the guide of listening to the worker and understanding their work context. So here's a picture. We have a printout version of the guide as well as the digital version. If anyone is interested in the printout version, just feel free to contact me. But you can see that we have the 3 tabs, the work, the health, and the claims context. And what I'm going to do is just walk you through an example in the work context, just to give you a sense of how the guide is set up and what some of the context is. So for instance, here with the work context, we have the table of contents. It starts off with some vignettes, some little scenarios to set the scene for what some work issues could be. And then we have these other different topics, and we have a whole table of contents for the health context as well as for the claims context. So in the work context, we have issues such as workplace mental health literacy, interpersonal workplace relationships, workplace communication during sick leave, workplace support of accommodations, employers' understandings of recovery timelines, workers' concerns about return to work, the fit of accommodations, flexibility in workplaces, health problems after return to work, and the psychological health of the workplace. So now I'm going to show you what one of the vignettes looks like, just to give you a sense of it. So this is a work context vignette, and I'll just read through this one so you get a sense of it. Difficult workplace departure and concerns about return to work May's story. So May used to be the social butterfly of the office, and so several colleagues took notice when she stopped planning social gatherings and she avoided opportunities to converse with coworkers altogether. After an outburst at work with a colleague, May took sick leave. Before she left, she'd been showing up late for work and had often left team members to finish her work at the last minute before presentations to potential clients. Although a few of her good friends had initially defended her behavior and said she was going through a tough time with family, when she failed to return their calls of concern, they stopped trying to call altogether. During the 4 weeks that May was away from work, no colleagues called to see how she was doing. In return to work planning meetings, May worried about coming back to work because she feared judgment and fallout of her past behavior. She was nervous about seeing her colleagues and didn't know what to tell them, which only compounded her anxiety. So you can see that there's a whole host of issues going on here. And for each of our scenarios, we have some of the roadblocks that are in the guide. So here we have interpersonal workplace relationships and workplace communication during sick leave that are identified. And then some of the alternate routes that you'll also find in the guide for various problems. So here we have ask coworkers about the best approach. Talk with coworkers about their concerns and needs, and include workers in return to work planning. And all of the alternate routes have a lot more text than that. These are just sort of headlines. So just if we look at the interpersonal workplace relationships roadblock, here's just an example of what that page would look like. So at the top, we have the description of the roadblock and the explanation of it. And then we have alternate routes. In this case, we have 3. For some of the roadblocks, we have 6 or 7 alternate routes. I'll just read through the description of the roadblocks just to give you a taste of this one. And there's a whole host of others for each of the items in that table of contents. So, but for here, workplace absences for workers with mental health conditions may be preceded by a period of poor work performance. Workers who feel they performed work poorly may be apprehensive about returning to work out of fear of being stigmatized or due to unresolved interpersonal issues with their supervisor or other workplace parties. As a result, even if a worker appears medically ready to return to work, they may resist returning. And after return, they feel uncomfortable with the situation. And then there's different suggestions for how to manage that. Just moving briefly on to the business reality. One of the key things that, so that's the guide and just a little snippet, little taste of what's in there. The business reality was another aspect of our research that came out of learning about the return to work coordinators and their own experiences being coordinators. And a key thing that we have to remember is that return to work coordinators are not independent operators. They're employees, they have managers, and they have performance targets. And so they'll work for an insurance company or a large business or that sort of type of business. And the organization's performance targets usually aim to align worker health and profit. But in situations of ambiguity, we could see situations where the business has the advantage. And an issue that became pretty clear to us throughout this study was the issue of return to work coordinator burnout, very high turnover in this role, and a lot of distress in relation to the conflicting mandates of health versus business. Just this one page, one slide on this topic, just to give you a taste of some of the quotes and issues in this area. Claim duration was a big issue for the return to work coordinators. They were judged based on how long their claims were. If claims started going on longer, that put a lot of pressure on them. Mental health was an area where claims tended to take a long time. And so they would feel really busy with the claims. And they talked about needing to balance economic needs versus workers' health. And so, for instance, here's Shannon, a coordinator, who said it was the fine balancing between the company's needs, the employees' needs, and the expectations of workers' compensation, because you're having to juggle all of these things. And in the company, we wanted to keep our insurance premiums down, our ratings up, and we wanted to be in good standing. And then finally, the return to work coordinator environment and the burnout and turnover. And here's just a quote from Kumar, who says, when I started, a colleague told me, you're not going to last. Anyone who sat next to me left within the year, which is true, because there have been some people who get into this line of work and find it a bit too challenging. So So that's another thing that we have to keep in mind with return to work and mental health and return to work in any health condition, is that there is a strong focus on rehabilitation and getting you back with the best practices, but there's also a whole financial structure around these issues as well. So just to conclude, our study identified complexities associated with return to work for people with common mental health problems, and identified, the key roadblocks and alternate routes relating to health, work, and claims. And our key message is, if we could boil it down to one sentence, is listen to the worker and understand the work context. And we have a digital version of the guide for anyone who's interested that's downloadable with this link at the bottom of the slide. And then also that the business side of return to work does exert an influence on the return to work process. And another recommendation is that more transparency about the business side of return to work could improve practices and build stronger relations of trust between ill or injured workers and among the involved parties. And that's it. Thank you very much.